Medicaid, which is what I'm going to talk about, was first established in 1965. And first, I've been asked to share information around 4 basic areas with you. What our role is at the Illinois Department of Healthcare and Family Services, and how we fit into this massive sea change as far as healthcare, Medicaid in our country, and also what the Medicaid expansion, what does that mean, and why is it important, and also to outline the benefits, what we're doing now in terms of services, and what we will be seeing, and also talk about the enrollment process. Let me just say that's at least 2 hours, at least. But so I'm going to speak quickly, and also I brought handouts also, so I will let you know where they're on the table, and I'll cite where one is available so that you'll be able to follow up with in terms of information, because there is a lot of information, there are a lot of changes, and we want to be very transparent in what we're doing. Oh, okay. Is that better? Okay, because I can't hear it myself. All right, then. As far as what we do, HFS, as I want to also first thank, of course, the Congressman, Bobby Rush, who I've known for decades, and being such a leader for us in terms of Congress, and also an advocate regarding the healthcare changes that we're dealing with, and to thank him and his staff for hosting this important event. As Luana just mentioned, we used to be called the Illinois Department of Public Aid, but the Illinois Department of Healthcare and Family Services is only part of that old agency. We're the money part, though. We pay the Medicaid bills. Our annual budget is about $18 billion a year. $15 billion of that is for Medicaid, and it's still not enough.
You just said billion.
Billion, not billions. Billion. We have an annual state budget, we're a state agency, an annual budget of $18 billion a year. $15 billion of it currently is dedicated to supporting Medicaid services, and it's still not enough. Now, we also collect and distribute child support. We also pay for extended services, nursing homes. Okay, even if you have Medicare, if you find yourself needing nursing home services, we're talking about Medicaid. Also, we help to provide resources for individuals to move out of institutions like nursing homes and also mental institutions if they're capable, and to provide the additional resources and support services they need to move back into community. People are healthier, can become healthier if they're in community rather than institutions, unless they really need institutionalized care. So we do a lot of other things too, and there's a fact sheet on all the other things that we do. But mainly we're an administrative agency. But that is changing because of care coordination. We're going to talk more about that as far as the new delivery system for health care through Medicaid services. Now, as far as Medicaid, I'm assuming all of you are familiar with Medicaid. It's the largest insurance health plan we have in this country. It's publicly supported, and it covers about 62 million of us at this point. 1 in 5 Americans, 1 in 3 children. That's how important this program is to the health of our country. Now, what we're going to move into and what we're going to be doing is that we found that with that, we are spending billions each year, not only in our state, but across the country, regarding almost $500 billion for services and Medicaid. However, the health care of individuals has not improved given the amount of resources we're putting in. And the reason why, aside from waste and fraud, which you hear about, the main reason is that our services are uncoordinated. They're fragmented. They're duplicated. Some of them aren't even needed. But we pay for that. So in terms of what we're doing, we've heard about the federal reform. There's also been state reform. Your state has been busy as your federal government has. And what we've done, starting 3 years ago, the state of Illinois, decided through the legislature and working with the governor's office to reform Medicaid the way it's done here in Illinois. And one of the things that was definitely decided was that we would move 50%, and right now we have 2.6 million, 50% of those receiving Medicaid services into what we call networks of coordinated care. Now, what are those? And many of them haven't been created yet. And you've heard about 2014 as a specific date for the federal legislation, the rest of it to kick in and to be available in terms of services, new services. Our date for this is in 2015, January 2015, to have moved these individuals into coordinated care networks. Coordinated care networks are the answer to why healthcare is not working, healthcare services, and why they're so expensive. What we're doing is setting up networks of care that will include behavioral health specialists, mental health, and also alcohol and substance abuse specialists. Also, of course, your medical specialists, and we're going to have them working with the clinics and the hospitals, and also your social service specialists and others, so that we will have a holistic approach to health care. After all, we're whole individuals, we're whole persons. We don't need a fragmented health care system. We need a holistic one, a comprehensive one. And by doing that, we know that your health care will improve. The services will improve, and the outcomes that you see as far as your own health will improve, and also the costs will go down with us working collaboratively, coordinatedly, and in a very new type of framework. So that's what we're working towards, and we're doing it rapidly. And also, in terms of, I was asked about who would be eligible as far as Medicaid expansion. Well, those of you who are already receiving Medicaid, you don't have to worry about going to enroll for anything new. This does not impact you. The expansion impacts those who have not been eligible. Now, who are they? Primarily they are adults who don't have children, or who are not the primary caregivers or guardians or custodians of children they may have. Right now today, those who receive Medicaid that we're able to provide services to are either children within a certain income range, their parents who are the primary legal custodians or caregivers or guardians, and individuals who are seniors over 64, and also those who have disabilities. Those are right now the 4 groups that can receive Medicaid services in Illinois. Starting in January 2014, they will be joined by another almost 400,000 of our residents here in Illinois. And they're the ones who will be, as I said, the ones who either don't have children or are not custodians of their children. But mainly they'll be predominantly and proportionately or disproportionately, depending upon which side of the glass you're looking at. A lot of them will be men. 51%, if not more, will be males, because they are the ones who have primarily been eliminated up until now from receiving Medicaid benefits. So we look forward to our men and our families and our neighborhoods and our communities joining us as far as being able to be eligible and access health care delivery of services that they need. And so we want to get the word out about that very much so. And though we know that our men are strong, they don't like to go to the doctor perhaps as much. So we're going to have to encourage them. First, explain to them that they're eligible for these services under Medicaid, and then also encourage them to go and take advantage of them. Now, With this particular group, we're looking at an income level of around 138% of what they call the federal